sickness you're dealing with more than you do, obviously. So he's had an incredible impact on my life, and it wouldn't be a stretch or unfair to say that he played a large part in the reason I'm still here as a person on earth. And so I'm deeply grateful to you, Michael. But secondly, he's had a profound impact on my wife. Most of you would know that a couple of years ago, her heart was really giving her serious problems. And every day, there was a season where every day she felt like she was having a heart attack. She wasn't actually having one, but it felt that way. And that's enough. It's a little bit of a stress producer when you feel like you're having a heart attack every day. And of course, his specialty is electrophysiology, so he has the ability to go in and zap your heart. And of course, I'm praying that he's going to have that ability today. But he literally changed my wife's heart. And so I am deeply, deeply honored and grateful to introduce my friend to you, Dr. Michael Lee. Would you welcome him?
Try not to get the cables disconnected here. Pray with me, please, for a moment. May the words of my mouth and the meditations of my heart be pleasing in thy sight, O Lord, my rock and my redeemer. Amen. I'm deeply honored and humbled to be here with you today. Honored to have Ron and Susan be my friends. Ron, what a blessing for God to have brought you through the valley of the shadow of death with your cancer. And we praise God that you're here to serve him every day. I'm humbled to be in your presence today because you have been called by God and you have accepted that calling and you serve his people every day. And I appreciate that. As a cardiologist, we have lots of toys. We have lots of medications. We have lots of techniques, tools, approaches to help people live longer, have more productive, happier lives. Sometimes we can save lives. We can treat many diseases, all with God's grace. But this is really on a temporal level. Okay, we deal with the current lives. And you have been called by God. You have accepted God's calling. You lead God's people. You direct us, the people, towards God, towards eternal life. And many, many, many people do receive the free gift of eternal life through Jesus Christ because of your efforts in your lives. You've devoted your lives, your time, every day, every waking hour towards God's people. And for this, I'm very humble and very grateful. My goal here today is twofold. One is I want to discuss issues of the heart from a cardiac point of view. And I also want to raise up some issues that may affect either you or perhaps your congregations. Psalms 51:10, create in me a pure heart, O God, and renew a steadfast spirit within me. There's so many references to the heart in the Bible, both spiritual hearts and perhaps physical hearts. 13.2 million people, Americans, have heart disease. 4.8 people have had strokes. 50 million have high blood pressure. Most of these are untreated. Some of these are in this room. 5 million and more each day are having heart failure. 5 to 10% of our population has diabetes, and this incidence is rising very, very quickly. In Romans, Paul says, I urge you, brothers, in view of God's mercy, to offer your bodies as a living sacrifice, holy and pleasing to God. This is your spiritual act of worship. Heart disease has been the leading cause of death for the past 100 years. It was actually very rare up until the 1800s. We've seen a lot of heart disease, leading cause of death every year except for 1918, where what happened in 1918? Flu epidemic. Other than that, heart disease is the number one killer. Heart disease and stroke leads to more deaths in men than all other diseases combined. All cancers, prostate cancer, lung cancer, accidents, suicides, etc. What's not known as much, however, is also that heart disease and stroke cause more deaths in women than all other causes combined. More than breast cancer, lung cancer, ovarian cancer, all cancers combined. Heart disease and stroke is the leading cause of death. Now, when we say heart disease, what are we trying to prevent? Okay, and first of all, we have bad cholesterol deposition in the arterial walls, and that's known as atherosclerosis. This forms a plaque or a collection of fatty tissue, inflammatory cells within the heart arteries, within the other arteries of the body, that then lead to spasm of those vessels and sometimes clots. Okay? What happens here is we all start, God gives us normal coronary arteries. But by our early teenage years, we already have little depositions of cholesterol within our arteries. Did everyone enjoy the bacon this morning? Okay. By our early teenage years, we already have little streaks of cholesterol within all of our arteries. The cholesterol then attracts foam cells, inflammatory cells that come in to try to pick up and scavenge and remove the cholesterol. Sometimes the cells die. The cholesterol within them stay there. This then develops into a plaque, which has a lipid core filled with cholesterol. And on top of that are linings of the arteries known as endothelium. As the lining of the arteries gets pushed up higher and higher and higher by more and more cholesterol being built up, the blood flow going through the remaining area accelerates, pushing faster. It's kind of like rapids on a river, and that causes stress on the tissue. And if there's a little break in that tissue, then we get a little clot. Okay, it's like a little paper cut, a little tiny 0.5 millimeter thickening. But if you only have 0.5 millimeter left, that clot, that thrombus, will then occlude the artery and cause a myocardial infarction or a heart attack in the classic sense. So this shows normal coronary artery, early atherosclerosis, progression of the same. Then there can be a little damage to the site. That leads to a myocardial infarction, coronary death, stroke. If it occurs in vessels down by the leg, that can cause leg pain with walking, also known as claudication. Okay? If a vessel is more than about 70% narrowed, then with exertion, we'll notice some chest pain, which then goes away with rest. Over time, this progresses. We get more pain with less exertion. Eventually, we get pain at night, and this is a crescendo pattern, which then leads to a heart attack unless we do something about it. What can be done? Early stages, we like to do medications. Angioplasty. Angio is Latin or medical ease, if you will, for blood vessel. Angiogram, angioplasty. Plasty as in plastic, as in moldable or formable. So angioplasty is when we go in with a catheter, we try to remold or reform the artery. We send in a little wire, little balloon into the area of narrowing, push it open, push all the bad stuff to the side, leave an open channel. Angioplasty. Sometimes that area tends to spasm back down. Then we put in a stent, which I call modified chicken wire, okay, to keep the artery from collapsing back down at that site. If necessary, if there are multiple vessels that are narrowed, we call our friends the surgeons, and they make a little tiny incision about 8-10 inches long. They go down to the heart, they bypass the arteries. It's interesting to see how much fat people have inside of them. In addition to the outside fat, there's visceral fat, where sometimes the surgeons, frankly, cannot see the heart, cannot see the arteries, because there's a layer of fat overlying the heart, okay? And they dig through that, they find the arteries, they bypass, they do wonderful work, but far better not to need their help, okay? What are some of the factors that we either can or cannot control? Well, factors we can't control are age. Time marches on, okay? Time magazine, 1930s, time marches on. Family history, we cannot select our parents, okay? And our parents sometimes feel bad that they got us, but you know, thanks for laughing. You guys are great. You're awake and everything. Gender, generally, we can't change that, although we're in California, and you know. But the genetics, that genetics follow your original gender. What things can we control? We can control abnormal cholesterol levels. What are the definitions of abnormal cholesterol? And LDL, more about that later, low-density lipoprotein, more than 100, is bad. HDL, high-density lipoprotein, the good stuff, less than 45, is bad. Triglycerides, more than 150, is bad. High blood pressure, bad. Diabetes, bad. Obesity, sedentary lifestyle. Stress, a lot more about that later. Cigarette smoking. These are all factors that, frankly, we can control with God's help. In terms of cholesterol, for every 10% reduction in total cholesterol, we can have our cardiac mortality decrease by at least 15%, total mortality decrease by at least 11%. Now, if we reduce it to 0, do we live forever? Well, we can't reduce it to 0. No, we can't live forever, but we can reduce our mortalities. Okay, what are the levels that we want? The LDL level, ideally, we want it 70 or below. If we can get our LDL, the bad cholesterol, low-density lipoprotein, down to 70, in fact, there's reversal of coronary artery disease. At that point, the arteries that have cholesterol deposited in them can start to see the cholesterol being pulled back out, sent back to the liver for reprocessing. So we can reverse coronary artery disease if your LDL is 70 or below. 100 or below, not bad at all. 100 and below, probably you're not placing any additional cholesterol within the arteries, and therefore the inflammation, the spasm, the clots, those all decrease commensurately as well. Well, how about if the cholesterol is 100 to 130? Not bad. An LDL of 130 to 160, now we're starting to have the discussion, okay? 160 to 190, we have a big talk, and I try to see if my partners would take you, because I don't want to have you in my practice. 190, there are exceptions. You guys are the exceptions. 190 and above, very, very high. This is really a dangerous level. We want to do something about it. How many in the audience know what your cholesterols are? Good, good. Okay, excellent. A lot of people have no idea what their cholesterols are. Okay, they say high, middle, low, or if it was bad, my doctor would have told me, or I haven't checked for years and years and years. Not good to stick your head in the sand and have no idea what's going on. HDL, high density lipoprotein, this is the good stuff. This is a recycling truck. Goes from the liver as a little flat particle, goes out to the periphery, starts picking up cholesterol, builds up, builds up, builds up. When the little recycling truck is full of cholesterol, goes back to the liver for reprocessing, another one gets sent out. So more is better. A low HDL of 40 is not good. Greater than 60 is excellent. And we'll talk about how to increase the HDL in just a bit. And triglycerides, similarly, 150 or below is good. We really want a low triglyceride level. 150 to 199 is medium. Above 200 is really a little too high. A little bit more on LDL. This is the bad stuff. This treatment of LDL elevations are the cornerstone of lipid treatment. It's strongly associated with heart disease. And again, a 10% increase results in a 20% increase in coronary artery disease. The reverse is also true. A 10% decrease is associated with a 20% decrease in coronary artery disease. But many, many people in the U.S. are undertreated. HDL, again, this is the recycling truck. This goes out and picks up cholesterol, brings it back in, and a low LDL is a big marker for heart disease. What are some of the factors that will decrease HDL? Smoking, sedentary lifestyle, obesity, diabetes, high triglyceride levels, okay? And then triglyceride, this is an older picture. These guys are not that chubby by modern standards, okay? There are many, many people that are significantly more chubby nowadays. And triglycerides, risk factors for elevated triglycerides, low HDL, obesity, sedentary lifestyle, again, smoking, diabetes, renal failure, alcohol intake, okay? Metabolic syndrome, we're seeing this more and more in the U.S. A little bit less in California, but really the U.S. is the world leader in metabolic syndrome. And that's a constellation of risk factors, and it's overrepresented among people that do have heart disease. And if there are individuals that have 3 or more of these 5 following factors, okay? Men, if your waist size is 40 or above, you are at risk. Women, 35 or above. Triglyceride levels of 150 or above, so know your triglycerides, know your cholesterols. An HDL level of either less than 40 or less than 50, depending on gender. Blood pressure, the systolic upper number, either greater than 130 or the diastolic lower number greater than 85, or a fasting glucose level. We should all know our fasting glucose levels of more than 110. 3 out of 5, you have the metabolic syndrome, okay? Prevention, reduce animal fat, reduce calories, lower fat foods if you're eating out, regular physical activity. Dietary options, the fibrous materials, including oats, gar, pectin, are excellent. More plant stanols are very good. Sterols are very, very good. Soy protein is very good as well. Here in Daniel then said to the guard, please test your servants. Now, the background, of course, is that Daniel and other captives were brought to Babylon. They were given rich foods, okay? Daniel and his friends wanted to eat foods from God. The jailer said, if you do that, you'll look terrible. They'll chop off my head. Please eat the rich foods. Daniel then said to the guard, please test your servants for 10 days. Give us nothing but vegetables to eat and water to drink. Doesn't that sound good? Then compare our appearance with that of the young men who eat the royal food, and treat your servants in accordance with what you see. I have a good friend who grew up poor in China. And after coming to the U.S., he's done fine financially, good Christian brother. And he said, you know, growing up poor in China, we had brown rice, we ate vegetables from the backyard. And now that I'm a Christian, I know that God gave the poor people the best foods. Whole grains, organic vegetables. God is so gracious. Okay? So, vegetables and water. No mention of bacon. Okay. There's a question I heard from someone today about statins. You know, are statins good for us? Are there long-term problems? Statins, Lipitor, Procol, rosuvastatin, also known as Crestor. A number of statins are out on the marketplace. Some are generic, very inexpensive. They block the cholesterol production in the liver. They're extremely effective. 5 to 35, sometimes more than 35% reduction in LDL level. It's once a day, very few side effects. The old recommendations were that, oh gee, we should check liver enzymes, we should check muscle enzymes every few months, et cetera, et cetera. Frankly, the side effects are rare enough. The new recommendations are no, we don't need to check liver enzymes, we don't need to check muscle enzymes. The vast majority of people do very, very well as long as they're taking it. They can take it long term. It reduces the risk of heart disease a whole bunch. Triglycerides. Triglycerides are incredibly related to diet. Okay, if I see an individual with a high triglyceride level, and if that individual can lose about 10% of body weight or maybe even 5% of body weight, start a mild exercise program, their triglyceride levels, frankly, really plummet quickly. Okay? Weight loss, exercise, all excellent. Now, some of you may say, yeah, I got a few pounds. When I talk to my patients and say, gee, you know, I'd like you to lose 5 pounds, I go, yeah, doc, I know it's hard. That tells me they're not going to lose any weight, okay? Now, for those of you in the audience that think, yeah, I should lose 5 to 10 pounds, it's hard, where's Leonard? Leonard, where are you? Oh, Leonard, stand up. Have you dieted and exercised and lost a few pounds? 335 pounds. Okay. Thank you. 335 pounds. How did you do that? God. Beautiful. So for you guys that are just a little chunky, in Chinese we'd say you're wealthy, okay? for those of you that are wealthy around the waist that need to lose 5 to 10 pounds, think of the example of Leonard, 335 pounds. Pray, exercise, don't eat too much, okay? Hypertension. Hypertension is defined as a systolic 140 or greater, or 85 on the diastolic or greater. It's a leading cause of strokes. It's a leading cause of heart attacks, heart failure, kidney failure, highly, highly treatable. It's difficult to treat because sometimes, frankly, people feel good if the blood pressure's high, and they feel bad if the blood pressure's low. Measure your blood pressures, aim for good levels. Salt. I had a little high blood pressure a few years ago, just a personal slide. Now, I noticed if I don't exercise, blood pressure goes up by about 10 points. If I have something salty, I eat out or whatever, blood pressure goes up on average by about 5 points. If I'm sleep deprived, I'm on call, I get calls all hours of the night, I go to sleep tired, I wake up tired, about 5 points. If I'm stressed, I'm trying to do electronic med records late at night, I'm forcing myself, pushing on the computer, about 10 points. Add them up, 30 points of blood pressure right there, okay? And so I'm trying to reverse those things, and I've gotten my blood pressure back down. But these are factors that are in your control, okay? In your control with God's help. What this slide shows is the effects of blood pressure, different color bars. If you also have high cholesterol, the risks of dying and heart disease go up. If there's glucose intolerance, pre-diabetes or diabetes, the risk is higher. If there's cigarette smoking and if there's an abnormal EKG, and you can see that these risks are pretty much multiplicative. They multiply on each other. So if you remove one factor, it doesn't drop by 20, 30%, it drops by about a half. Remove another factor, it drops by another half. So you really don't want to have multiple risk factors stacking up, multiplying all along the way, okay? Diabetes in America, very, very, very strongly associated with obesity. They all come as high blood pressure, diabetes, obesity, low HDL, high triglycerides. They all come as a package. An individual that has had a heart attack has a higher risk of having a second heart attack. That's pretty logical. An individual that has diabetes has the same risk of a first heart attack as a known heart attack patient having a risk of a second heart attack. Markedly elevated risks of heart disease, heart attacks. When we do angioplasties, when our surgeons do bypass surgeries in a diabetic, generally we find lots and lots of areas that are either acutely narrowed or chronically narrowed, big areas, the whole, not just single parts of the arteries, all the arteries to all the vessels are significantly narrowed, okay? This is reversible, this is treatable. Newer medications can be extremely effective, okay? Now, the next slide here is about obesity. And I used to think of fat cells as just being little storage units. You know, you put the calories in there, they sit there, they don't do anything else, they kind of wait for something else to come in. But in fact, fat cells are extremely active metabolically. They secrete a substance called adiponectin, which sensitizes the body to the insulin receptors and has anti-inflammatory properties. As fat cells get bigger, the adiponectin secretion decreases, then stops, insulin sensitivity drops, obesity gets worse, okay? Now, in addition, the fat cells, again, they're metabolically active. They consume calories. They don't just kind of sit there. As a general principle, for every pound that a person has, you take in about 10 calories per pound to either feed muscle or feed the fat cells. So if someone weighs 200 pounds, in general, for an adult, we take in about 2,000 calories. If someone weighs 250 pounds, in general, we take in 2,500 calories, okay? And the calories go to maintaining the fat cells. If we decrease dramatically, all of a sudden, yeah, we can get a little weight loss, and then the diet goes back up in calories, and the weight yo-yos, and it rises more and more. And so the way to decrease your weight is do it gradually, do it consistently, and remember, don't feed the fat cells over time, okay? Moving on, body mass index. There's a formula for this, and it's weight in kilos divided by height in meters, or if you do pounds and inches, it's pounds divided by your height in inches squared times 703. And the incidence of obesity in the U.S. is increasing markedly. Just to put some numbers on what may be a complicated formula, if you're 6 feet tall, and your weight is at or above 220, that is a medical definition of obese. If you are 5 feet 4 inches tall and you are 175 pounds or greater, that is a medical definition of obesity. Overweight, same parameters of 6 feet or 5 feet 4 inches, 183 pounds, 146 pounds respectively. This is kind of a scary slide for me. This shows the incidence of obesity among U.S. adults in 1980, 85, 90, 95, year 2000. In 1985, as you can see, very, very few states had an incidence of obesity greater than about 10 to 14% here, okay? Some states had an obesity level of less than 10%. By 1990, there were a number of states that had a 10 to 14% level of obesity in the general population. By 1995, a number of states had 15 to 19% of their population defined as obese, with high blood pressure, diabetes, heart disease, etc., going along with it. By year 2000, last year this was done, there are a number of states where more than 20%, the red states, not politics, this is obesity, the red states have more than 20% of their population obese, and the dark blue states have 15 to 19% of their population being obese. The trends have leveled off a little bit, but this is not a good place to level off, okay? 30% of adults are currently obese, 65% are obese or overweight. The risk of cardiovascular disease increases fourfold, and a 40-year-old male who's obese has a 7-year decrease in longevity. Okay? So, Proverbs, have you found honey? Eat only as much as is enough for you. It is not good to eat too much honey. Okay? So, question. American Heart Association recommends how many minutes of exercise per day? I'm going to have people raise their hands for the different parameters here. How many say 5 minutes per day? Okay. How many say American Heart Association says 10 minutes per day? Good. 30 minutes per day? Excellent. Wow. Okay. 45 minutes per day? Okay. 60 minutes per day. Got it. All right. Now, next question. How many minutes per day on average in the last month have you guys exercised? Okay, per day. 5 minutes or less? Come on, this is a Christian group. You guys should be honest. 5 minutes or less? Okay. 10 minutes? Okay. 30 minutes per day on average? Wow. Okay. Okay. 45 minutes, 60 minutes. You're good. Pastor Ron, you're good. Okay, excellent. In talking with people, it's interesting when I ask pastors, and I've kind of done a little survey about what your needs are, the pastors will always say the right answer. I want to lead the congregation. I want to point them towards God. I want to have our leadership be focused. And the wives go, I just want time for us. I want him to exercise. I want to have spiritual communion with my husband. So vastly different answers. Okay, I kind of doubt the 5-minute exercise time, but American Heart Association, moving right along. American Heart Association recommends 30 minutes per day, 5 days per week. Any aerobic exercise where you get tired, a little hot, a little sweaty, that counts, okay? Housework, vacuuming counts. Washing the car, except for water, savings, etc. Washing the car is good exercise. Yard work counts. Washing dishes standing there, frankly, does not count. But any aerobic exercise you do, preferably something that you enjoy, counts, okay? In addition to helping the heart, it improves mental, physical, and emotional health, okay? Ecclesiastes, also that every man should eat and drink and enjoy the good of all his labor. God created our hearts, our muscles, our bones for exercise, okay? It is the gift of God, okay? So now 30 minutes per day, how do we squeeze that out of our busy days, 5 days per week? My goodness, that's 150 minutes per week. Now, however, God is very fair to all of us. We all have 24 hours per day. We all have 7 days per week, 168 hours per week. So 150 minutes is less than 1 minute per hour per week for your heart. Okay, when I have a similar talk to a church audience, I'll say God gets 10% of your income. Actually, God's income goes back to God, 10%, and your heart gets 1 minute per hour for its exercise. Okay. Cigarette smoking, we're in California. Not a lot of people smoke, but surprisingly, still in California, a fair number of people smoke. Across the U.S., a lot of people smoke. Cigarette smoking is the single highest risk factor for heart disease, leading cause of lung cancer, associated with many other forms of cancer, head and neck, tongue, etc. Children of smokers have higher rates of asthma, other lung disease. Children of smokers are more likely to start smoking as well, okay? This is a new slide I put in. Over the last 20 or so years of being in practice, I have seen a huge increase in the number of individuals, patients that have severe cardiomyopathies, really, really bad hearts. Young people, because of cocaine and methamphetamine. I don't think you guys do. I think a number of people in your congregations may have this problem. So keep this in mind. Work with your congregations. Help them, okay? There's a cardiovascular risk calculator, HTTP, cardiovascular disease risk from the National Heart and Lung and Blood Institute, National Institutes of Health. You can copy this. This will also be on the video that will be available later. Okay, so you can look up your own heart disease risks. Stress. This one slide, this one word, has given me more stress, Sundar, more anxiety, than the rest of the talk combined. I have felt a lot of pressure from the evil one. I've had many of my good friends, my fellow prayer warriors, pray for me. And with the sharing of my anxiety and with the prayers of fellow Christians, I've felt that pressure ease up. And I feel that this is an important message, not so much from me, but from God, perhaps for many of you. Stress is a huge part of your life, okay, as pastors. How would you guys rate your stress levels? And let me see a show of hands. Low, medium, high, very high. Low, low stress, okay? Medium, medium stress, a lot of hands. High stress, a lot of hands. Very high, okay, thank you. Appreciate the honesty. Which of the following two verses describes how you feel? I have labored and toiled, and I have often gone without sleep. I have known hunger and thirst, have often gone without food. I've been cold and naked. Besides everything else, I face daily the pressures of my concern for all the churches. Okay? All right? 2 Corinthians. Now, in Isaiah, but those who hope in the Lord will renew their strength. They will soar on wings like eagles. They will run and not grow weary. They will walk and not be faint. So I'm going to ask how many feel like this first verse. Okay. All right. Okay. Video's not showing the audience, right? Okay. How many feel like you're flying, floating on wings like eagles? Excellent. Okay. I think the stressed people outnumber the eagles in here. Okay. Now, when I ask, well, pastors, you're under a lot of stress, and as a non-pastor, it seems to me, and perhaps other people could have input here, that congregations tend to put you up on a pedestal, then take turns shooting at you. Okay, you know. The sermon's too long, it's too short. Too many opinions, too few opinions. Wishy-washy, too opinionated, all of the above. Okay? When I ask my patients who are pastors whether or not they feel stressed, the pastors just kind of hang their head and they just kind of have a real look of sadness and they say yes. The wives get really animated. They get really angry and they tend to say something like, "You have no idea," and they're doing this. Of stress that he is under constantly. They're on call 24/7. They're constantly working. We get phone calls at all hours. You can't sleep at night because the phone might ring, and this goes on and on and on. My feeling is that pastors, you folks, have a lot of stress. Stress is indirectly related to heart disease, high blood pressure, poor sleep, sleep apnea, rhythm problems, relationships. Stress can be one of the main reasons that you folks have your ministry curtailed. Okay, either early retirement, fatigue, being battle worn, the vision of soldiers coming together, needing rest, needing food, all of that. Those images come into play. Now, as a cardiologist, I don't really feel qualified to address a lot of this. I do want to raise this up as an issue for you and Pastor Ron to discuss between yourselves. What possible options do I suggest as a non-pastor, as a non-psychologist, psychiatrist, as a cardiologist? Accountability, having people that you can share with, that hold you accountable, that can support you. Lots and lots and lots of prayer, private and group Bible study. Exercise. Exercise is a wonderful, wonderful stress reliever, okay? Getting enough sleep, okay? How many of you get enough sleep, okay? Now, in addition to sleep, this also raises an issue of sleep apnea. How many of your wives say you snore so loudly, okay? Now, it's not just a marital issue. When you are snoring loudly, basically the airways get choked, okay? The heart then says, "Oh my goodness, I'm being choked." The blood pressure goes up. The heart has rhythm problems. You fall asleep during daytime hours. It's a huge problem. Okay, so if your wives say, "By golly, yes, you do snore a lot," that means let's get it checked. There are treatments for this, masks, etc., weight loss exercise, etc. And boundaries and balance. How do we have boundaries and balance? I don't really know. Pastor Ron, if you can figure that out, talk to me. Please let me know afterwards. But boundaries and balance are very important, okay? Just one slide on depression. Depression can be extrinsic, it can be intrinsic, it can be genetic, but depression in the presence of heart disease, and this talk is more about heart disease, heart failure or cancer is strongly related with increased mortality. Mortality rates may double in the presence of depression. Okay? Proverbs, a cheerful heart is good medicine, but a crushed spirit dries up the bones. Okay? Faith, prayer, people of faith and do live longer, have healthier lives. There was a study at UCSF when I was there as a resident where there were two groups of individuals, and Randy Bird was a professor of cardiology, ran a controlled, blinded, clinical, scientifically valid clinical study, had people praying for people in the coronary care units, okay? Half the names were given. The people praying had the names with the patient's consent, but otherwise there was no contact. The half of the people that were prayed for did much better than the other half of randomly selected, non-prayed for people. Prayer is effective and it works. Martin Luther, I have so much to do that I shall spend the first 3 hours in prayer. Okay? Relationships. People that have healthy relationships, church, God, spouses, family, live longer, have healthier lives. Men, you men that are married, you're lucky. Men that are married live longer than single men. Married women, not so much. Medical facts. Medical facts. Okay. Okay. Symptoms. Now, what if I have crushing substernal chest pain, radiating to the arm, coming up to the neck, sweating, comes on with exertion, goes away with rest, now it's getting worse? Bad. See a doctor right away, make the call, do the 911 thing. But symptoms don't always necessarily mean that you are going to die of your heart. Okay? Sometimes symptoms can be a way of God or your body trying to tell you that something is wrong. Not necessarily medically wrong, not necessarily life-threatening in a medical sense, but it could be saying you are under stress. Okay, you may not know it. Your MRI scan would show it. Okay, you are under stress. Your body is trying to tell you something. Could be a headache, could be chest pain, could be palpitations, could be stomach pain, could be joint pain. Different ways. Learn what your body is trying to tell you, just like us men need to learn what our wives are trying to tell us, like, obviously, you know. Sorry. Okay. But the signs are right there. My wife's going to see this later. Just pray for me. But symptoms are not necessarily a sign of disease. It could be just your body trying to talk to you, God trying to talk to you, okay? And conversely, lack of symptoms, not knowing what your blood pressure is, not knowing what your cholesterol is, having a family history of heart disease, not exercise, lack of symptoms does not guarantee health. You got to know your numbers, okay? Conclusions: know your cholesterol, know your blood pressure, watch your weight, eat sensibly, exercise regularly, 30 minutes per day, okay? And also in terms of stress reduction, prayer, support groups, accountability groups, and invest in your relationships. Most importantly with God, but also with everyone else. Okay. Thank you very much. You guys are a great audience. Thank you. Okay.